Okay, so let's talk a little bit about the strategies themselves. So behavior strategies are going to be introduced into a person's plan when the team has identified some kind of risk. It's important that that process, as Shelby said, to be data driven. And what that specifically means is it's based on a risk that we have actually seen, actually documented. It's not just something that we feel might happen. It's not just something that we worry might happen, but a risk that we actually have observed. This might be through UIs. It could be through formal behavior data that the team is collecting, maybe with the help of a behavior specialist. But the team should have supporting documentation before any discussion of possible risks and or especially the potential use of a restrictive measure. Behavior data is also helpful for a number of other reasons. It can determine patterns in the behavior, perhaps a situation, a time of day, a particular staff person, a type of task. Behavior data can kind of point out which of these areas might be problematic, and then the support team can kind of look at, is there a way around that situation? Is there a way we can make it more manageable for the person? Um, and in general terms, it helps to determine, are the strategies we're trying working or are they not? And working in this case being decreasing the severity or the frequency of the behavior we're trying to help the person with. Um, the first step in devising strategies for a behavioral challenge is for the support team of the individual, including that individual, absolutely bringing them into that process to examine that behavior that is occurring, what's happening around the individual. Are there changes to that person's life? Was something in the environment that might have contributed? Have there been any major changes? You want to make sure to rule out physical causes for the behavior too. Dental pain, urinary tract infections, a variety of other medical conditions can affect somebody. I mean, just think, when you're sick, when you're in pain, you're not at your best. The folks that we work with, it's really the same thing. Don't forget about mental health conditions as well. That also is a health factor that can affect these. Can be useful to talk to an individual psychiatrist if they're receiving that service about any potential mental health factors that might be contributing to a situation as well. So the functional assessment is an important tool that's part of this process of devising strategies. And what that does is it's a way to analyze the person's behavior in detail to try to get at, where is that behavior coming from? You've heard by now the idea that behavior is communication, and oftentimes communication of some kind of need. The functional assessment kind of allows us to get at, what is that need? What is that need that's being communicated? Now, there are specific qualifications for who can do that. So a person who would fill out a functional assessment either needs to be somebody who holds a professional license or certification by the Ohio Board of Psychology, the State Medical Board, or the Ohio Counselor, Social Worker, Marriage and Family Therapist Board, or they hold a certificate to practice as a certified Ohio behavior analyst, pursuant to the revised code, or they hold a bachelor's or graduate level degree from an accredited college or university and have at least 3 years of paid full-time or equivalent part-time experience in developing and implementing strategies and risk reduction strategies or plans. So the functional assessment depends on behavior data to determine the frequency of a behavior as well as trends or patterns of how it occurs. And remember that if somebody is working with staff around the clock, no one of them is going to get the full picture of what that person's day is like. It's only by bringing all that information together that we really get to have a good picture of that. The functional assessment will also critically suggest a possible replacement for the behavior that's occurring. This will allow the person to meet the need the behavior is communicated in a safer and more socially acceptable way. Introducing a replacement behavior is an absolutely critical step in developing behavior strategies, as attempting to just simply stop the behavior without meeting the underlying need is very unlikely to be successful, and in fact may lead to frustration on the person's part, which could make matters more tense. Okay, so examples of the functions of behaviors, the why behind these things that are occurring here. Let's remember as we go through these, behavior is a form of communication and often a communication of need. So destroying property, why would a person do that? A simple one is to express anger. If I don't have a good way to communicate my anger to the people around me, maybe my communication skills aren't up to that task, maybe I don't feel like I'm being listened to, I'm going to let my actions speak for me, and that may be one way that I do it because it's unlikely to be ignored. Alternately, I may be mad at that device. If, for example, I'm diabetic and I don't like the numbers that my glucometer has been reading, I might damage the glucometer so I don't have to deal with it. Just always be thinking about the why behind these. Calling 911 during non-emergency situations. Why might I do that? Well, let's remember what that sets in motion. One thing that it does is it brings very important people to me, and it's something that cannot be ignored. Now my staff are having to deal with the emergency services. I'm getting to talk to them. Maybe I'm getting to go to the hospital. It's a really great way for me to get some control over a situation when maybe in my day-to-day life, I don't have a lot of control. That is very much the case for the folks that we work with. A lot of decisions are made for them. A lot of times we, despite our best intentions, may fail to give a lot of leeway for how their day goes. And this is a way to kind of grab that attention if I don't feel like I'm getting that attention and that control. It can also be a good way for me to just stop what's going on, to get a change of scenery, to stop some kind of activity or part of the day that I don't want to take part in. Threats of self-harm, another one we might encounter. Now, we all know that threats of self-harm are always something that we take seriously. We also know that there are individuals where that threat of self-harm is less about an actual desire to harm ourselves and more about, I am really trying to communicate something. A person does not make that kind of threat unless they are upset, whatever their intentions may be. So we listen to what is it that is upsetting that person. It may also be a symptom of an underlying psychiatric condition, and that's going to be something that you really want to talk to mental health services about if the individual has it. And if not, maybe it's time to actually start looking at that. Also important to remember is that boredom can be a major contributor to behavior. That and a desire for control are common themes that occur in all of these situations. So the goal of the behavior strategies that we would devise is not just to reduce the difficult behavior, but to provide that individual with a safer alternative to the behavior to get their needs met. The individuals will be relying on their staff and their support teams to model these strategies. We want to focus on the positive behaviors that we want to see rather than focusing on the negative behaviors that we don't. Because as we know, attention, whether positive or negative, can oftentimes be reinforcing. So we really want to feed attention for that positive progress that we're trying to encourage in the individual that we're working with. Strategies need to be clear and they need to be specific. This is both so that the individual that we're working with can understand and implement it. It's also going to be so that their staff can understand it and help to model it with them. They should be tailored to an individual's specific strengths, their goals, their interests. Behavior strategies are always going to be focused on the person that they're intended for. And we really want to recognize that progress with behavior strategies is oftentimes going to be gradual, and we want to encourage even that gradual progress. Here. I want to take just a moment here and give a pause for you guys to think for a second about ways that you might calm down if you're angry. Anybody can get upset during the day. I want you to take a second to consider, how is it that you might calm down? So these strategies that you utilize are likely to be no different from any other that a person might use. Um, oh, gosh, I'm sorry, I messed this up here. Um, sorry, it's I'm having trouble matching this up to where my So before we go to the next one here, I want to take just a second to do just a brief activity with you. I'd like everybody to take just a moment to think of things that they do to calm down. You know, any of us can encounter situations where we get upset or angry during our day. The individuals we work with are no different. But I want you to think specifically about yourself for a few seconds here and what kind of activities you might do. So, okay. So maybe you've had a chance to think of some. Um, Common examples, you know, do I take deep breaths? Do I pause for a second and count to 10? Do I listen to music? Do I maybe go for a walk, take a break from the area? You know, these are some fairly common ones. Um, the truth is that the need for these is just the same, exactly the same as it is for the individuals we work with, and the same kinds of strategies might work for them that work for us. And the thing is that they're going to be relying on staff to help guide them to use these to use these strategies, and also to kind of model them. We're always going to be more successful in encouraging these coping strategies if we can do them along with the individual and kind of show them how it's done, rather than just telling them to do it. So as I said, counting to 10, deep breaths, these are pretty classic ways to calm down. um, other ways that we can kind of replace risk behaviors, communication is a big one. If the behavior is used for communication, let's remember that if we get that communication need met, we may not have the risk behavior going on also. You know, a person may find that communicating through words is just not as effective for them. We could use pictures or visual aids either to communicate something to the person or for them to show us what they're trying to do. Um, Very important also to offer choices to an individual. You know, can we do this or this? Would you like to do this or this? Very natural for a person who's offered a choice to want to take that choice, even if it kind of guides them in a direction that we're trying to urge them to. It shows that we value the person's input and want to give them control over their day. So that's always going to be a good way to establish a good relationship with someone. So, as far as the process of developing behavior strategies, it's very critical for teams to remember that the individual should always be central to the discussion. They should be giving input as well. They can tell us what might work and what might not work. And getting the individuals buy-in to a strategy is a great way to ensure that they feel like this is they're a part of that decision making. They feel like the strategies are something they've chosen rather than something that's being imposed on them from the outside. Um, we definitely want to use the results of the functional assessment when we are devising strategies, because remember that they need to be based on actual data that has actually been recorded about the behavior. Again, we want to integrate choices for the individual so that they feel that sense of control and ownership of what's going on. They always should be an opportunity for the person to feel safe, because that's ultimately the goal. Is we're trying to reduce risk, put that person in a safer place, and make them feel safer and that their needs are being met in the same way. Um, and ultimately, we also need to factor in the individual's specific needs. We may need specialized communication tools. We may need visual tools. There may be physical objects that are part of this, and the team should discuss how those are going to be obtained and utilized for the purpose of those strategies. Um, Ultimately, teams need to always be examining the behavior strategies they're using to make sure that they're safe, that they're working, and that they're still needed. This is especially true in cases where restrictive measures are present, because restrictive measures are always assumed to be temporary, and there are strict requirements by rule on those. Teams should be meeting at least every 90 days to discuss strategies. That is an absolute requirement for cases where there are restrictive measures. Part of that discussion needs to be analyzing the behavior data that is collected, so that even though one staff person may be seeing one set of behaviors from the individual they're working with, and another staff may see something totally different, taken together, we can get a big picture of what's going on. We can evaluate if there are any trends or patterns. Critically, we can decide, is there still a risk in this person's behavior? Do we still need to have strategies in place to address that? We're going to be seeing if the behavior is more effective by measuring that data. If we find that there is no risk present, we're going to need to talk about removing strategies from the plan. This is very specifically referring to restrictive measures. If somebody's risk is no longer present, if we find that they have met a fading criteria for that, a restrictive measure has to be removed in this case. Team members do need to make sure that they still have the resources to implement the strategies. We want to make sure that every staff who works with the person is trained on those strategies, so that they can also help that person to reduce their risk, and so that we're providing a consistent approach, and that the person we're working with can feel secure in that consistent approach. Ultimately, the goal is always to try to meet that fading criteria, and we want to make sure that we're keeping accurate notes of the person's behavior so that we can see if we're approaching that. And let's remember to encourage even gradual progress in that area. Okay, so that's pretty much it as far as the discussion of behavior strategies. If there are any questions, I would very much encourage you to reach out to your support team and the behavior support department, and hopefully we can answer any questions that you may have on this. I wish everybody good luck with working with the individuals they're working with and helping them through their struggles, especially in these unusual times. And hope everybody is safe, and make sure to remember to wash your hands and take all the precautions you need to. Thank you.